All right, we're going to talk about hip and knee pain. Why does my knee or hip hurt? Typically what happens is the knee or hip sits wrong for too long. Remember we talked about in another video how we want everything to sit right, and if it doesn't sit right, it's kind of like your car being out of alignment and the tread will wear abnormally on the tires. So when things sit wrong for too long, wear and tear start happening. Now when we evaluate somebody with hip problems, we want to see if the two hip heights are the same. And if one hip is higher than the other, that's going to lead to wear and tear. And there's no set rule on what happens if the higher hip is going to be the one that causes the problem or the lower hip. Either one could have a pain. And what will happen is that hip is like a ball and socket, okay? And the hip has room to maneuver. And over time, if the hip sits wrong, the hip will start to fuse into that joint. And at the last stage, the hip will be totally fused into the hip socket. And then it's a surgery case where they rip out that hip and they put in a fake one. And we don't want to be to that point because about 50% of hip surgeries fail. They need to be replaced after a period of time. So the fake ones aren't as good as the one that God gives us. So we want to stop that from progressing to that point. We want to get the hips straight so that they start maneuvering correctly and that there isn't going to be some wear and tear that happen. All right, so if the hip sits wrong, it's normally a 20-year scenario where it can become where it's fused. Okay, and most everybody nowadays knows of somebody who's had at least one hip replaced. Okay, now by the same token, we want the pelvises to be level, we want the sacrum to be level, and sometimes if the hips are wrong, it may not cause a hip problem, but could cause trouble into the knees. Same thing, if the hips are wrong, the angles of the knees will be incorrect, and over time, all those bones related to the knee can start to wear incorrectly. We check the patella alignment, that's the kneecap. We want that to be straight and correct. A lot of times that patella will move off to the side laterally, and if that happens, then the knee can start to deteriorate and eventually can get to a point where the knee needs to be replaced. Also, we look at the other bones below the kneecap, the tibia and the fibula. So the fibula is the smaller non-weight-bearing bone in the bottom part of our leg below the knee. That's the bone you hear somebody who breaks their leg and walks 5 miles to the hospital to get help. It's a non-weight-bearing bone. If you break the tibia, you're going to be crawling those 5 miles to the hospital. Okay, so we're checking all of these bones. We're checking the pelvises, we're checking the sacrum, we're checking the hips, we're checking the kneecap, we're checking the patella, we're checking the fibula. Any or all of those could be out of place, and they frequently are when I have people that come to me who've never seen a chiropractor before. And over time we can correct those. We can prevent disasters like having to get knee or hips replaced. It's another reason why you should see a chiropractor. Why would you wait until your body's so far gone and then go see a surgeon to have to get things replaced? Why wouldn't you get things looked after and preventing something like that having to happen? Most people will spend more money maintaining their car than they will their body. Fancy that. Isn't that an amazing concept? Why wouldn't you want to maintain your body? It's not like you can go to the body yard and get a new knee from Kmart or something if it wears out, like you can trade in your car. You only get one body. Let's look after it. Okay.